Hello everyone, this is N. Ramya, pursuing my second year in IT department, CEG Anna University, also a member of the Guindy Times, the official campus magazine of CEG, ACT and SEP. Medicines cure diseases, but only doctors can cure patients. The Guindy Times takes immense pride in interviewing Dr.A.Arunagiri sir, who has completed his MD General Medicine in the year of 2000, did his diploma in the field of diabetology, completed thesis on leptospirosis, and is currently treating COVID-affected patients. He has given treatment to more than 300 COVID patients and has prioritized his duty towards the sick more than anything else in this trying time like this crisis. On this occasion of Doctors' Day, the Guindy Times is excited to celebrate this hero for his selfless work during the coronavirus pandemic. A very happy Doctors' Day to you, sir. We welcome you. Would you please introduce yourself?
Yes, madam. Good morning. Good morning, everybody. I am Dr. Arunagiri, and thank you for your Doctor's Days. I did my UG as well as PG in Annamalai University, and 2000 I finished my MD graduation, followed by I finished my diploma in diabetology. For the past 20 years, I am working in the field of diabetes as well as the field of intensive care medicine. And we are dealing with a lot of acute emergencies like stroke and respiratory failure and cardiac problems. So day to day, we are working with that field. But for the past 2 years, we are having our lifetime pandemic, very pathetic condition. We are dealing with a lot of very sick patients with respiratory failure due to this COVID-19 pneumonia. Okay, thank you.
Glad to have you here, sir. Can you briefly explain about coronavirus and its varying symptoms?
Yes, madam. Corona is not a newer virus in this world. Already it is a zoonotic disease. Basically, it's a zoonotic disease. It is a highly contagious one. Very rarely it spreads to the human being, and now it spreads as a pandemic. So the symptoms are they will present with fever, cough, sore throat, and anosmia. Anosmia means loss of smell and taste, and some people they will have diarrhea, and even they will present with breathlessness due to respiratory failure, and severe body pain, joint pain, and loss of appetite, severely tired patients. Some people they will present with even altered sensorium because due to their brain is involved, altered sensorium or unconsciousness. And some people they will present with myocardial infarction or stroke. Even they will present with severe respiratory distress. Yes.
Very informative, sir. So, moving on, the world has seen viruses like SARS before, but those were epidemics, and now COVID poses to be a pandemic. What is the reason, sir?
Because in 2004 we had our first SARS-1. It is presented. It is epidemic in Southeast Asia, and after that MERS. It is in 2012. It is affected only in the Arab countries. Those two episodes they are coming from the corona family only, but the thing is the contagious is very high with this COVID-19. That's why it spread as a pandemic. Compared with the previous SARS and compared with previous MERS, the COVID-19 virus is highly spreadable and it spreads very fastly. So that's why it became a pandemic now.
Very painful to hear that, sir. So, what hardships did you face during the treatment of COVID patients?
Actually, the thing is, most of the time in our setup, the people they are presented very lately to the hospital, so they presented with so many complications like respiratory failure and even sometimes renal failure, and presented with the CNS symptoms like unconsciousness or altered sensorium, encephalopathy, like that, and sometimes some liver parameters also elevated. So people, it is sometimes we can prevent those deaths and those high morbidity, the disease pattern. That is sometimes due to the ignorance or due to the lack of awareness. People, they are not coming to the hospital in the proper time. So the disease pattern is changed. It become very severe. Sometimes we lost the patient. Really, in young patient, we are losing. Their family is totally dependent on them. It is really very painful for us to treating those patients.
Yes, sir, definitely. It's very painful to hear that. Endless hours of working to keep us safe and healthy. Your efforts are greatly appreciated, sir. Thank you so much. So, moving on, according to you, who is the high risk population pertaining to this pandemic?
Actually, people age above 60 years, people with diabetes, already known respiratory disease patient like bronchial asthma or smokers, COPDs, already known neurological patient, known liver disease patient or kidney failure patients, or patient who are taking immunosuppressant therapy for some other drugs, for some other diseases, or like a patient taking long-term steroids. And these people, they are highly vulnerable to have a COVID because those people's disease will become very severe compared to other people.
Thank you for letting us know, sir. So, how does this virus spread and why is it spreading quickly this year compared to the previous strain?
Yes, now the virus is spread by droplet infection, and sometimes they are speaking like it's a airborne also. Droplet means while a person is coughing, the the drops the fluid in his lungs or air pipe, it's blow out in very fastly. It will reach us the other person. Those people, they will inhale or they will it is contact with the eyes or it will contact with the nasal mucosa or oral mucosa. Then those people, they will have the infection. So compare with the last year's, the first wave, this time there is the RNA virus become slightly mutated. Now you are reading in the newspaper, there is some kind of UK variant or African variant or Brazil variants, or now in India we are speaking about Delta plus variants. So compare with the last year COVID-19, the original virus, this virus, the transmission rate is very high compared with those people, and the severity also very high compared with last year.
Much needed information, sir. Thank you. Will India be affected by a third wave? Enlighten us with your thoughts on this, sir.
Yes, madam, because we are a very huge population in the world. The in a limited time, it is not possible to vaccinate each and every one. But our people, we have to vaccinate ourselves. We have to come forward to vaccinate very fastly, and we have to cooperate with the government. So then only it will preventable from the third wave. Now they are predicting by October we'll have the third wave, and they are also predicting the third wave will affect mostly the pediatric population, because already the last two waves, the pediatric population is not affected. Now they are predicting the pediatric population will affect very severely. Yeah, most of the time the pediatric patients are asymptomatic because there is a receptor called AC receptors. It is presented in the lungs, heart, like that, kidneys. This virus is attached to the AC receptors. Then only it will produce some exudates in the fluids inside the lungs, and it will produce consolidation, like it means the lung becomes solidification, and followed by the fibrosis, because there is a fiber formation inside the lung. Because due to this only the patient going for a respiratory failure. But most of the pediatric cases, the people will become asymptomatic because the number of AC receptors in pediatric lung is very low. So those people will have infection, they will spread the infection, but most of the time they don't have the severe symptoms like adults. but they will potentially to spread the infection to the elders in the family, like that. Otherwise, the pediatric people, they will have the systemic inflammatory response syndrome. Like there is a syndrome called multi-organ failure. Due to this virus infection, they will go for a severe multi-organ failure, multi-organ involvement that leads to endangerous to their life. So it is really alarming. We have to more precautious. We have to think about the pediatric population vaccination in future, and we have to protect our community, and we have to protect our future generation from this third wave. For this, the only way is we have to go for a vaccination as early as possible.
Hence, I must say it is vital for all of us to practice social distancing even now. So,
Yes,
vaccines are believed to be effective in fighting against COVID. What is your opinion on this, sir?
definitely. In from this pandemic, by vaccine only we will overcome this tough fight with the COVID. So everybody we have to go for a vaccination as early as possible. Whichever vaccine it is, we have to go for a vaccination now. It's the time for vaccination. Okay.
I believe everyone will get vaccinated after listening to you, sir. Thank you. My next question: how will one know whether to get hospitalized or quarantine at home?
But I mean, COVID, we have to separate the disease in four parts. One is asymptomatic patient, another person is a mild symptomatic, another one is a moderate symptomatic, and another one is severely symptomatic patient. A person without any symptoms but RT-PCR is positive due to a routine test. Those people, they don't need any treatment. Only thing is they need a isolation for minimum 14 days, and from their family and friends circle, they don't need any treatment at all. They are watching for their respiratory rate and oxygen saturation, and their pulse rate and other parameters. They have to take a good protein diet, and if necessary, they can take any vitamins and minerals. And another people, it's a mild disease. It's presented with small sore throat, running nose, throat irritation, fever, and like body pain without much other difficulties, sometimes with diarrhea. Okay. So how can we can differentiate is their pulse oximetry, in pulse oximetry, the oxygen saturation is more than 95%, and the respiratory rate in between 12 to 16, and their temperature is less than 101, like that. And and they need some small amount of antipyretic like paracetamol and some vitamins and antihistamine agents to control the cold. Is more than enough for them. Okay. Uh,
Much needed
uh,
information, sir.
and moderate disease, the people will have the SpO2 less than 94, and uh, heart rate is more than 100, and temperature more than 110, and the respiratory rate is more than 24. These people immediately they have to go for hospitalization. This is the one point. So the saturation is below 94 and the respiratory rate is more than 24. They can monitor themselves, and the temperature persistently more than 101. Another simple test is there is a test called 6 minutes walking test. A person check his SpO2, that is oxygen saturation, then he have to walk continuously for 6 minutes. If it falls below 94 after the 6 minutes walking, or it falls below 5% of his original O2 saturation, those people we can ask them to get admitted in the hospital. So it's a self-test. They can monitor themselves. Every day they can do 2 or 3 6 minutes walk. It is not applicable for senior people like age above 65 years or any cardiac patients. But for normal person, they can go for a 6 minutes walk test.
Thank you for letting us know, sir. Does COVID infections have long term effects?
Yeah, sure, madam. Because this COVID, this will produce the coagulopathies. That is that there is a hypercoagulation state is having to the human body. So this leads to myocardial infarction in the near future, or cerebrovascular accident like stroke. Patient have a hemiplegia, or the person will have a DVT, deep vein thrombosis in the legs, and there is a life-threatening condition called pulmonary embolism. It means a blood clot inside the vessels going from the heart to the lungs. There is pulmonary embolisms, and sometimes people presented with the encephalopathy with permanent residual neurological deficit. These things are leads to a permanent long-term effect in these patients. And some people, they will have a post-COVID colitis, like they are presented with long-time diarrhea, like that they are presenting. From this point, what I have to tell is we have to take anticoagulants or antiplatelet agents as per your physician's concern advice for minimum 6 weeks to prevent these long-term complications from the post-COVID status. So all the post-COVID patients, they have to take antiplatelet or anticoagulants for minimum 6 weeks to prevent thromboembolic phenomena, thromboembolic complications.
Right, sir. So, post COVID is also a very crucial period.
Yes.
Finally, how can one protect themselves from this vicious virus, sir?
So we have to maintain our social distancing first. We have to maintain minimum 2 meters distance from anyone, and all avoid all near future social gathering like meetings, marriages, or community activities. And we have to wash our hands regularly each and every time we are touching some public areas or handrails or door locks, those things. We have to use our sanitizers, or we have to simply wash our hands with soap and water. And we have to wear a mask. It is preferably N95 mask, or we are going for a, it is unavoidable circumstances, we are going to the crowd, we have to protect with double play mask, with four play mask inside, and there is a N95 mask outside. So we have to wear a double play mask in that condition. And the first thing is we have to vaccinate ourselves. This is the only thing we can protect ourselves from COVID.
We'll definitely follow that, sir. Thanks a lot, sir, for taking out the time and effort
Before
for
that,
this. Yes, sir.
I want to enlighten regarding that vaccination. I want to enlighten, madam. Who are
Yes,
the
sir.
people they
Sure,
can
sir.
go?
Go ahead, sir.
Yes, in vaccination, all the people they are eligible for all kind of vaccinations. It is there is no difference between this vaccine is best or that vaccine is best. If you are whatever vaccine is available, first go for that vaccine. This is Covishield or Covaxin or Sputnik. There is no difference between, no major difference between those vaccines. See, there is no panic regarding this vaccine will leads to death or not like that. In even newborn, we are giving live polio vaccine 0 dose. It is day one we are giving live polio vaccine, and next day we are giving BCG vaccines. From our childhood, we are every day we are having vaccines. So you have to take those vaccines. And the technology for this vaccine is very old, like our mumps, measles. They are using some kind of killed virus only. They are using the technology is very old only. So it is very safe, and the vaccine doesn't produce any COVID disease at all. Very rarely only, very rarely only. Some people they lost their life throughout. Otherwise, there is 99.99% the vaccine is very safe, and it is like people. they are already taking the vaccine, they are developing disease means it is not due to the vaccine. It is they are in between the after the 2 doses only. These people have a full immune protection from COVID. Okay, so in between they are developing that COVID infection means it is due to their carelessness, not due to the vaccine. Okay, first this point they have to confirm this. And a person infected with COVID, he was recovered. After 4 weeks, he can take a vaccine. This is another point. A person presented with a neurological deficit, that is CNS, some nerves diseases or kidney diseases or cardiac diseases, diabetes, asthmatic patient, they have to go for vaccine first because they are high risk population, the age above 60 people. So those people, they can take the vaccine as early as possible. And the person who is taking immunosuppressants or a person they are taking steroids for some other diseases, they have to stop the drug for minimum 2 weeks before the vaccination and after the 2 weeks from the vaccination with their physician's consultation, then they can go for vaccination. As well as people, they are taking blood thinners like aspirin and clopidogrel or some other blood thinners, they can take the vaccinations. There is no contraindication to take the vaccination. People, they are taking blood thinners. As well as people allergic to some food or allergic to some allergens in the air or allergic to some previous injections, there is no contraindication for getting the vaccine. Only contraindication is there is previous history of COVID vaccine or any other vaccine leads to severe anaphylactic reaction is the contraindication. So they are allergic to, I am allergic to do this food, I am allergic to do this fragrance, or I am allergic to some other thing. It is not a contraindication for taking the vaccine. Okay. And immunosuppression patient, the patient having already like HIV and like some other natural congenital immunosuppressant diseases, they can have the vaccine, but the thing is only that Covishield they can take because it is coming from the M protein. It is not coming from the killed virus. So Covishield is ideal for immunosuppressant patient, and pregnancy and lactation safely they can have their vaccine. Okay, pregnancy ladies as well as the lactating mother, nursing mother, they can take the vaccine safely. Okay, so
very informative, sir. We all will definitely get vaccinated. Thank you, sir.
Thank you.
Thanks a lot, sir, for taking out the time and effort for this interview. I'm very sure it would have been helpful for all of us out there fighting this pandemic together. I would love to express my gratitude towards you being the frontline warrior during this COVID crisis. Thank you, sir, and once again, happy Doctor's Day to you.
Thank you, madam. Thank you.
Thank you, sir.